Welcome back to our study of mind rubrics, and let's begin with our rubric for today, which is confusion. Yeah. So, what does confusion as a word mean? Confusion means people do not understand what is happening. People don't understand what is happening, what they should do, or who someone is or something is. What they should do, who someone is or something is, or a situation often with a lot of activity and noise in which people do not know what to do. So, like one example is like our homeopathy. There are so much of different activities happening, different seminars, different courses, different methods, different this. Now, what do I do? There's so much. I don't know what to do. This is confusion when you don't know what to do. There are too many options, or you are not able to recognize things. So there is something happening here, but you are not able to comprehend what is happening here. What is this person talking in this video? I'm not able to understand. I'm not able to make sense. What is he talking? Confusion. What does confusion mean? So this inability to make sense of what is happening around, what is happening here. What is he talking about? He's talking about mind rubric. What is it? I don't understand. I don't understand. This is what is confusion. I don't understand what is happening. I don't understand what I should do. I don't understand how I should react. Correct? Now, this is what you learn from literature, the meaning that I taught till now. After this, what I have done is, this is a very big rubric, confusion, and there are so many remedies in it and so many sub rubrics in it. It took me more than 1 month to read and to find what exactly uh, our uh, masters, or what exactly did Kent see to write this rubric and to mention these remedies in that rubric. No, see, one is, did Kent know the meanings that are given in Google today? I don't think so. No, he must have had his own idea of confusion. Maybe it is same to what it is today. Maybe it is not. So who knows? So the best way to verify it is very simple. You go to all these remedies that he has given in that rubric, read their provings, and then from those provings you have to see what is it that is coming up commonly to represent confusion. Yeah, what is the common pattern in all those remedies? You have to read all the provings of all those remedies. So I must have read around 10-15 high grade remedies from that rubric. So what I understood is, basically the first and most important word that you come across is this: I I forgot. I was thinking this, and then now it has skipped my mind. I'm not able to remember. I'm not able to tell you what exactly is happening. Okay, I wanted to say something, I wanted to do something, but I am not able to. So this sudden vanishing of thoughts, I was talking in between, I have lost the thread of it. In between, I've lost not just the thread of the thought, what you get is, I've lost my senses. I lost my senses. I I am not in grips with the situation. That I am in this room, I am sitting on a chair, there's a table over here. Suddenly I feel, where am I sitting, what is happening, what was I doing? It seems a little bit like disoriented. No, I don't know where I'm sitting, I don't know what I'm doing, I don't know what I'm talking, I don't know. Give me some time. I'm lost. I'm lost. I don't know. Just let me bring myself back. This desire to bring yourself back, to gather yourself back, there's too much work I am doing, so suddenly I lost my what thought process. This vanishing of thought process is what is coming up repeatedly when you read the provings. Vanish of thought. I have forgot. I can't remember. I was doing this, suddenly I vanished. It is not, it may look like loss of memory. No, loss of memory. I can't remember names of people. But important thing is, while I am working, while I am doing something, suddenly this happens. Why is this happening? I think it is because I'm doing too much. I think it is because so many things I'm thinking. I think it is because so much of work. So this too much work, too much thoughts, too many this things happening. This is what suddenly then my mind gets confused. Doctor, nowadays work at family also is more, at workplace is also more. Then I confuse. Are this place I came with my wife, or did I come with all my colleagues? What happening? I'm not able to remember. I forget. I'm confusing things. Is this with whom we did this, with whom we did that? I'm not able to remember. I forgot. This is confusion. I'm not able to exactly put things into perspective. I'm getting confused nowadays. I'm mixing up things here, there, here. You know, because too much work, so many things happening once at a time. I'm working also, and then suddenly my wife calls. I talk with her also, and then I keep, and then, what was I doing? What was I saying? No, this is what we see nowadays. No, there's too much of work, too much of things happening. So time is passing too slowly or too fast. Things are happening very fast. I think slow it down, slow it down, slow it down. Only then you will be able to concentrate. Only then you will be able to be there. Otherwise, I feel like my mind, it's not working properly. It's got dull. It's got stupid. It's not remembering things. I'm not able to get things quickly. It's feeling like, Arey, this one year I was going to talk, I was going to tell you all of this man, Arey, acha, it was not here. Oh, it was in that place. I got confused. I'm sorry. No. It was not here. It was not in this rubric. No, it was somewhere else. This is what happens. They feel that their mind is overloaded, overburdened. It is getting fatigued. It's not acute. My senses are not acute. It's not sharp. I'm getting fatigued. I'm getting overwhelmed by things. I feel just relax. Otherwise, this mind is too much happening. So instead, do less things. Concentrate, do well. But even if I am doing less things, no, now I am finding, this concentration I could do, now I am not able to do. Yaar, what happened to my mind? Previously I could do, now I am not able to do these simple tasks. Previously I used to do them like this. Now I am not able to do. My mind is not functioning as it used to be. I'm searching for simple words, for simple things. I'm searching. What was this? What was that? What was this? What was that? Where did we do this? How did we do this? So this memory loss, forgetfulness, along with feeling of so many things. Because so many things are happening, because I am overwhelmed by so many things, I am forgetting things. So memory loss is only forgetting. Nowadays, doctor, I am forgetting things. I am not able to remember. Suddenly, I want to remember this street's name. I am not able to remember. This is memory loss. Nowadays, doctor, there's so much of happening, no, that things skip my mind, or I am not able to remember things that I usually remember. So, it is happening. I know this is happening because too much of things are happening. Too many things, too much work, overwhelmed by work or overwhelmed by thoughts. This is what is dulling my mind. This is what is not letting my mind function properly, and I am forgetting things. This is confusion. Forgetting things out of overwhelm. This is what is confusion. Forgetting things out of overwhelm. Feeling mind is not sharp enough. Mind is getting dulled because of so much of activity. So I'm lost, I'm bewildered due to so many ways, beliefs. I'm lost. I relax. I was too much now, too much. Hmm? Now what to do in this? What is right, wrong? Don't ask me. Don't ask me. Forget it, yaar. अब मेरा दिमाग नहीं चल रहा है. Now my mind is not functioning. Let me settle down. Let me calm down. Only if I calm down, then I will know what to do. The water is very muddled now. No, let me settle down. Let me calm down. Let me relax for some time. Then I will have clear thoughts. Then I will know. This is what I have to do. But now there are too many thoughts, too many things happening. So no, I've done mistakes. I'm doing a lot of mistakes nowadays because I'm trying to do so many things. I don't want to do this. Let me calm down. Let me do one at a time. I will have more clarity rather than confusion. Hmm? So it is like I feel I attended this seminar and then I feel, array, this is good method. Huh? Then I feel attended that seminar. Then I feel this also is good method. Then I feel that seminar. Then I feel that also is good method. Now which what to do? Oh my God! Now my mind is getting confused. Too many things. Too many. Bapre, this also, that also. You have to see miasm also. You have to see symptom also. You have to see physical also, modality also, mental also, physical general also. Then he says only mind. He says only physical. He says only this. Now what do I do? Arey yaar, जाने दो. Forget it. Let's relax. We'll do something else later on. We'll think about homeopathy. This confusion is what is seen within all of us actually. Lot of questions in mind, but no answer. What is the answer to this question? Hmm? So that's what confusion is. I hope I did not confuse you and I gave you clarity. Okay. So then, so this was just some symptoms I might have copied from some um, book when I was reading. Okay, so remedies. Now I've just taken few sub rubrics, not all, just few, just by my own choice. So basically, now what I see here is why I choose beer from. Now, what is interesting is in beer from, generally what we think ailments from alcohol. First remedy we think of is Nux vomica, right? But you know, Nux vomica is not there over here. So what it tells us is in our repertory or in our materia medica, there is specificity. So for example, just today morning I was discussing this. For example, I in the classroom I said that patient had constipation and this constipation was relieved by straining and leaning backwards. Hmm? So I asked the class, what do you think? So they said that this leaning backward is seen in diascoria. So, you know, better by leaning back, maybe diascoria is the remedy. Now, what is important here is we have to understand that diascoria is pain in abdomen, better by leaning back. Now, this patient had constipation, better by leaning back. So, these are two different things. So, Nux vomica has what frequent ineffectual desire for passing stools from alcohol. So, it is stools and alcohol. So, confusion and alcohol are different. So this combination of what is the effect of drinking water is different in different remedies. So sometimes what happens is we only look at common remedies that we feel, alcohol means Nux vomica. And Nux vomica is not even there in this rubric. So in fact, colocynth is the highest grade remedy. So be specific. Another important thing is it's not alcohol. See, beer it is given. If you look ahead, no, there is more specificity. See, wine also is given. So we to never ask. Kal, kal, yesterday I drank and then my complaints began. Then we say okay, alcohol we take. But in our repertory we have so specific. What did you drink? You drank vodka. You drank beer. You drank wine. Do we ask? And we should ask, this is why I choose these rubrics, that we have to be more specific. What is the effect? Is it pain? Is it diarrhea? Is it constipation? Or is it confusion? First, effect. Second, Even if it is alcohol, can we specify the alcohol? What type of alcohol? Both these are important. So see, spirituous liquid liquors, only there Naxomica is given. So like this, we have to be more specific in our rubric selection and in our case taking. Most important is case taking. If we are not going to be aware of this, then we will not ask, we will not think, we will just take alcohol. No, but if we know, array, there is wine, vodka, and also such rubrics are there in our materia medica, then we will ask patient. So what did you drink yesterday? You okay, alcohol, but what specific alcohol? Whether was it beer, vodka, whatever. So search more specific symptoms. Also, the effect of alcohol also has to be specific, whether it is confusion. Then you look in confusion rubric. If it's constipation, constipation after beer or wine or this or whatever, so on and so forth. Carousel is basically party where you drink also. There Naxomica is given. Concentration. Why? This is one very common rubric that we see in our daily routine. Yeah, concentrate the mind on attempting to. So patient says, when I sit to study, that is when I am not able to concentrate. I lose concentration. The moment I attempt to read something, I feel, oh my god, this is so much, so many symptoms, so many rubrics. Oh no, no, no. And by the end of the doctor, I don't remember anything. I open Materia Medica book. I read one symptom, two symptom, three symptom, four symptom. Then I close. What did I read? I don't remember anything. So many symptoms are there. So many this is there. I don't remember anything. I feel that it's a waste of time to read. This is what essentially confusion means. That I do, doctor, I do put so much effort, but then I see it is so much that loss of confidence and loss of desire to study. I feel I can't remember anything. People remember, doctor, they study, they remember at least, they read 10 symptoms, they read at least 2 or 3. I am not able to remember even one. Read, forget. Read, forget. This is what is confusion. Next sub-rubric is confusion, identity of. Now, this is also interesting for me because I have talked about Illumina in many of our previous rubrics, that it has confusion of identity, that patient does not know what they want to become in life, whether they want to become doctor or engineer or whatever. Who will I become? This is what is Illumina. But I came to know that there are actually 15 remedies given by Kent. I didn't know this. I was always thinking confusion of identity is Illumina and that's it, over. But there are 15 remedies. Illumina is one of the remedy in that. So each remedy will have a different kind of confusion of identity. We need to study that. Interrupted when. This is also very commonly used expression by people who study. I remember one patient who was preparing for government exams here in India. A lot of competition is there where people prepare for years to pass government exams like UPSC, MPSC, all that. So one patient used to always tell me that, doctor, I am fully concentrated, I am fully studying, I am doing everything. But my only problem is when I study, I should not be interrupted. I am studying and then someone calls, hey, come here, let's have lunch. Why did you call me? I was fully focused. I was in there. I was doing. Now he has called. Then now they will talk something. Now they will talk about this. They will talk about this fight happened, that happened. Then my mind gets confused, doctor. Then my mind is like, oh, this also is there. Now this also is there. So many problems in family. How will I handle this problem? Oh my God. Now I don't feel like studying. Now I don't want to study. Now what do I study? Now should I study or should I handle this problem? What should I do, doctor? I don't understand. Family problem come, then I am thinking family problem or studies, I don't know. And I tell these people every time, once I am concentrated, I am sitting here, don't tell me that, array, this is not there, that is not there, this noise you make, that, no, don't, just let me focus. The moment you tell me this problem, I am confused. Now what to do? Study or solve this problem, study or solve this problem. I don't know, doctor, what to do. This confusion when interrupted. Then paroxysms of pain. During pain, patient becomes confused. Now I don't know what to do. So I remember one patient I saw in COVID. He was in the hospital. He had he very red congested face, very red congested face. So I asked him, what is happening to you? He said, you don't know, doctor, how what is happening to me. I said, what is happening? No, no, you will not understand how much suffering I am, so much I am in pain. I asked him, what is happening? Are you feeling breathless? No, no, not breathless. As of now, I don't have breathless. But my whole body, everything is paining and I am suffering. My God, I am suffering so much. What are you suffering? That I cannot tell you, doctor, but I am suffering a lot of suffering I have. It's so much of suffering I have, so much of pain I have because of this COVID. This is what is confusion, where patient is not able to tell their symptom. What is happening to you? That I cannot tell you, doctor. Tell me, no, what you are saying. I am suffering a lot, so much pain. What is happening? That I don't know. I can't tell you what is happening to me, but I have lot of suffering, lot of pain. This is what is this rubrics meaning. That patient tell that I have lot of suffering, lot of pain. Describe your suffering. That I am not able to. I don't know how or what exactly is happening to me. Doctor, that you don't ask me. I cannot tell you what exactly is happening. But I am having a lot of pain and suffering. I am suffering a lot. Please do something. I am really suffering a lot. Actually, I didn't know this rubric or understand this rubric at that time. But looking at, I very distinctly remember he had lot of congestion, very, very red face he had. I think maybe aconite or something like that could have been very useful for him. No? Confusion with pain and suffering. Confused. I can't tell you. I am so much in pain that I cannot tell you how much I am suffering or what I am suffering. Only I know. He used to say, only I know how or what I am suffering, but I cannot tell you. I cannot tell you. So much suffering I have. Siesta is basically after sleep. After sleep, especially in hot weather. It was an unusual word, so I just took that rubric. So, like that also. So, in our repertory, you have weather influence, alcohol, specific alcohol. Studying also, we have to ask. Generally, what happens? Why I chose these rubrics? Because we feel this confusion rubric, generally students and they will tell us that I am confused after studying so much. This is too much work. This is so many thoughts, etc. We have to listen more attentively. What is confusing the patient? Is it too much work? Is it what interruption? Is it just the reading? That we have to classify. You should read more sub rubrics of this rubric to understand how to treat such literary people. You will get more idea. So this slide I already showed you. Wine. There is also a rubric which says writing while. So like this, friends, this is what I learned from this rubric, and I really hope it helps all of you in your practice how to basically see this rubric and use it in your practice. So cross references before we end. Cross references. Chaotic. I have done this rubric already. Chaotic. Chaotic means what? Again, what is the similarity? Too many things happening. Too many things happening that I don't understand. I don't feel comfortable with it. And what I want to do is I have to now systematize things. If I have systematized things, then I will be okay. Confusion is there are too many things, but I have to relax. I have to calm down and I have to let the mud settle, and then my senses will become alert. If my senses become alert, then I will be having clarity. But in chaotic, they feel that I have to put things in order. I have to arrange all this. If there's so many thoughts, doctor. I read Materia Medica. There's so much. Now I feel if we have a system, no, if we have a system in place, and if I properly lay down how and what the symptoms are and how they develop, and I develop a picture out of it, then that orderly study of Materia Medica will give me clarity. This is chaotic. Chaotic, wants order. Let me bring order, then I will remember, then I will be clear. Confusion says, let me make myself more alert, more cautious, more sensible. If I'm more sensible, I will know which path to take. So confusion is always looking for which path to take. Chaos is always looking for system. Create a system, you'll have clarity. Confusion, calm down, strengthen your senses, you'll have clarity. That is the difference. Disoriented is, I'm disoriented, I don't know where I am, what I am doing, I'm lost and confused, it's all disoriented. But main thing is disoriented, in disoriented is loss of sense of surrounding. Where am I, what am I doing? This thing is more prominent. Where am I, what am I doing? It is not I'm lost in my own thoughts or my feeling, etc., but where am I, what am I doing? What is this place? Surroundings, the importance of surroundings is more in disoriented. Confusion patient also will say, I'm so confused. Which place was I? Was I in this place or this place? Or where did we go? Did we go here or there? Did we go from this road or this road? There are so many turns over here. Which turn? Which turn? Ruk, just settle down. Huh? Just give us our time. We will know. We will know. This what confusion will tell. Disoriented will only constantly keep saying, now I don't know what to do. Where am I? Where am I? Where am I? Confusion is alertness. I want to increase my alertness. If you see, I want to increase my alertness, or if they feel that my senses are dull, they are a little bit more conscious. Disoriented, the consciousness is even more less. They don't even know that they are sort of disoriented. I'm disoriented. The consciousness level is even little bit more lower than confusion. Where am I? Where am I? Where am I? This is what is disoriented. Confusion, where to go? Where to go? I'm little bit confused. Okay, let me think. Now, let me think is confusion. Disoriented, they stop at where am I? Where am I? Where am I? That is the difference. Okay. Okay, friends. I hope this brings clarity. I really look forward to all your suggestions, and please do write how you felt the explanation of this rubric was. Um, I look forward to your comments. See you all in our next rubric. Till then, bye bye.